Okay, to start off my hand and wrist assessment, I'm going to begin with palpations. Okay, so we have his hand. You have the scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. There you can feel the hook of the hamate. And then you have the radius, you have your radial head, your ulna, your ulnar head, and then you have your 5 metacarpals, so you can palpate down those. 1, 2, 3, 4, 5. Okay, and then you get into your phalanges. So you have your proximal, your middle, and your distal phalanges. Distal, proximal, middle, and distal. Okay, next I'm going to do range of motion. So to start with the wrist, I'll do flexion and extension passively. Flexion, extension, and then radial and ulnar deviation. Just like that. Okay. Next I'll have flexion extension of the phalanges. Okay, so I'll support his hand here. And I'll just move flexion and extension. Thanks. Flexion and extension of the phalanges. Okay. And then I'll do each joint flexion and each joint flexion and extension. Okay. And then you can do a abduction, a deduction of the fingers. Okay, and now I'm gonna have him do active. So can you do flexion and extension of the wrist? Okay, and then do radial and ulnar deviation. Okay, and then you can do your phalanges just like this, flexion extension, and then do abduction and adduction. There you go. Okay, and then I'll have him do resistive. Okay, so push up against my hand, go all the way. Okay, and then back down, go, good, good. Okay, and then I'm gonna support his arm, and I'm gonna do each of the phalanges. Okay, so up, good, up, okay, and then back down, all the way. There you go, again. Okay, and then I can go ahead and do each joint up, all the way, down, all the way. Okay, and then I'll just move down, up all the way, good, down all the way. Okay, again, up all the way, down all the way, up all the way, good job, down all the way. Okay, so you just go through and do each of the specific joints. And then for special tests, you do varus and valgus of the UCL and the RCL. So to do that, I'll stabilize the wrist, and I'm just going to test the stability of the UCL and RCL with varus and valgus. And then next I'll do the carpal glide. So for this, I want his wrist stable on the table, and stable on the table, and I'm just going to move his hand up and down so I get the carpal glide. Okay, next I will do the Watson test, which is for scapholunate instability. Okay, so for this I'm going to put my hand on his scaphoid, and I'm going to apply pressure, and I'm going to radial and ulnar deviate his hand, and you're looking for any popping or clicking within the scapholunate area. Next I will do Allen's test. This is for circulation. So I'm going to have him flip over his hand. I'm going to apply a pressure on the radial and ulnar arteries for 20 seconds. and I'm looking for that loss of circulation. And then after 20 seconds, I'll release, and I'm looking for the return of the blood flow to the hand. Okay, next I'm gonna do Tinel's sign, which is for carpal tunnel. So I'm looking for the carpal tunnel area on the hand, and I'm just gonna tap. And if the patient has any numbness or tingling in the fingers or the thumb, then they could have, it's a positive for carpal tunnel. And that's it.